Good afternoon, everybody, and welcome to our media briefing for today, the 23rd of September. As is usual, I'll turn the floor over to Dr. Fitzgerald, our Chief Medical Officer of Health, for her update on today.
Thank you, Minister. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have no new cases in the province, and our total number remains at 272. 268 people have now recovered, and in total we have tested 38,960 people. I'd like to begin by addressing concerns raised by residents in Labrador West regarding new confirmed COVID-19 cases in the Kaniapis region of Quebec. The special measures orders that apply to communities in the Quebec Lower North Shore and the Labrador Straits, as well as the Fairmont and Labrador West border, remains in effect. We are working with public health officials in Quebec, and the Public Health Authority in Quebec continues to monitor the situation in the Kaniapis region and advises the risk of community transmission is low at this time. Every day we have individuals coming into Newfoundland and Labrador. I ask that you be kind when you encounter these people coming from away, as we do not know another story. I also ask for patience and respect when interacting with border security at airports and ferry terminals, as well as with our public health officials in the regional health authorities. These are people who help the public and provide much needed services within our province, and they have been an integral part of getting us to where we are today. The same applies to school administrators, teachers, and other school staff who are navigating new procedures and requirements in our schools so that our children and youth have a safe and healthy learning environment. Today marks 2 weeks into the new school year. Each September is an adjustment period for parents, teachers, children, and youth as new routines are established. This year even more so, as COVID-19 public health measures have altered how we go about our daily lives. I know that the adjustment has not been easy for everyone, and I thank everyone for the continued patience as we head into the colder months of fall, navigating life with COVID-19. Due to the diligence adhering to our public health measures over the last 6 months to prevent the spread of COVID-19, the spread of other common viruses slowed as well. And as a result, many of us have not experienced the common cold since the pandemic was declared in March. As more activities and social interactions have been permitted with the loosening of some public health measures, and as the cold weather approaches, common viruses are once again circulating. Many symptoms of the common cold are the same as COVID-19 symptoms, and this can understandably cause anxiety if you or one of your family members begins experiencing one of these symptoms. As a reminder, if you or your child are experiencing 2 or more symptoms, you are concerned, please complete the online assessment tool or on our website or call 811 for further guidance. After months of being apart, teenagers and young adults have more opportunity to socialize with one another. And we know that vaping has been on the rise among youth. It is even more important than ever for parents to talk to their children about topics like cannabis use and vaping, particularly now in light of COVID-19. While these activities have always held inherent health harms for youth, there is now the added risk of COVID-19 transmission through the sharing of products used for vaping. Across the country, we are seeing that the number of COVID-19 cases is increasing among young adults. As a parent or guardian, I encourage you to take opportunities when they arise to start the conversation with your young person about the harms associated with vaping. Discuss the facts and help inform any misunderstandings. Be open to discussion, and remember the goal is to have a meaningful conversation and not to lecture. This approach can help set the stage for further conversations about vaping and other topics that are important to them and their health and well-being. Thanks to your cooperation, our province has been successful in keeping COVID-19 at bay, but we must persevere and learn from the lessons of other jurisdictions. I encourage the youth in our province to keep up their efforts. You have helped us maintain our low prevalence to date with your adherence to our public health measures. This low prevalence has enabled us to lessen some of these measures as we hope to continue on our current path of living with COVID-19 with everyone's support. Another topic also on the minds of many this time of year is Halloween and trick-or-treating. So our COVID-19 situation might look quite different in 5 weeks, but If our low prevalence of COVID-19 holds, there is no plan to cancel trick-or-treating for children. With diligence, this can be done safely. We are developing public health guidelines which will be available on our website at gov.nl.ca/COVID-19. These guidelines will help support families in their Halloween festivities, and they will address social gatherings, trick-or-treating, and how to safely hand out treats. Much of the guidance will be familiar to you and your family as it draws upon our tried and true public health guidance. This Halloween, if you are feeling ill or are self-isolating for any reason, do not go trick-or-treating. Similarly, ask someone else to hand out your treats or place a sign on your door to ask parents and children to skip your home. And if you see these signs, please be respectful and kind to these families, as they may be disappointed about not being able to participate this year. Parents or guardians should consider going trick-or-treating with their children for safety reasons, as well as to ensure physical distancing is maintained. And when it comes to social gatherings, consider keeping these within your bubble of family and friends. As I said, these guidelines will be on our website in the coming days, hopefully by the end of the week. As a recap, for those who may have just joined us, we have no new cases since yesterday's media advisory. The total number of cases in the province is 272. Thank you again for your perseverance. Please remember to be kind and have patience with others as we all navigate life with COVID-19 together. Thank you.
Thank you very much, Dr. Fitzgerald, for your update. I would like to echo your comments about how diligent folk in the province have been in adhering to public health guidelines and recommendations, and it's because of those efforts that we see the results that you've just described again today. Today is actually day 200 of our COVID pandemic, and it's been a challenge for everybody to stay the course. From the point of view of the province, we're in a good position. But we can't let our guard down, because as Dr. Fitzgerald referenced, if you look across Canada, the situation is not quite as comfortable or rosy. If you look at Ontario, Quebec, British Columbia, and Alberta, you will see that they are having significant increases in new cases. Ontario is averaging 450 new cases a day and has done for the last little while. They have outbreaks in long-term care facilities, which had, over the summer, become relative havens for seniors there. Quebec has already essentially declared a second wave. There's an 85% increase in cases. There are cases in long-term care, and there is an increase in hospitalizations, which would suggest that it's not just the young and healthy who are now contracting COVID, as the numbers rise. I think it's important to bear this in mind when you consider what travel, particularly outside of the province and outside of the bubble, you may regard as necessary. And I think we need to keep and will be keeping a very close eye on this situation over the coming days and weeks. Issues that have come to my attention as questions, which I feel important to address. There have been comments again about workers coming into the province from outside. I can best speak to health. The arrangements there were for facilities with equipment where the technical expertise and engineering that we require to keep these machines running may not actually exist in the province. That's often in the past been done on a regional or even a national basis. So, for example, if our PET scanner or our MRI has an issue, the idea is that the appropriate technician would come in. They would not be roaming around. They would isolate when not at work, and when at work, they would work in a controlled environment with COVID-19 precautions. They would finish their job. They would test the machine, the equipment, make sure it's working, and then that would be then cleaned prior to any use by patients. And these individuals would then leave the province expeditiously to wherever their home port, as it were, was. There's no roaming around, as it were. On the issue of essential workers in other trades and other businesses, we in public health and the Department of Health rely on the companies who want to bring these people in to make the determination as to whether these folk are essential. We are not experts in construction or experts in technology. We rely on their common sense and due diligence to tell us that an individual is essential. We simply set the parameters that they have to isolate when they're not in their workplace. And I think for those individuals or groups who have questions about whether a particular trade or a particular skill is one that needs to be brought in from outside, those questions should really be addressed to the contractors, the companies that are bringing these individuals in. We're not in a position to adjudicate. The other piece about isolating workers or isolating individuals has been raised is access to medical services. Very early on in COVID, we made it quite plain that there would not be any denial of access. And indeed, the special measures orders are written in such a way that they do have access to medical services, to dental services, and these kind of things. They simply need to make their isolation status known to the individual. As far as regional health authorities are concerned, the issue of whether or not this can wait till the end of isolation is actually a clinical decision, and we do not make that. That's made by the clinician whose care the individual might fall under. So for those people who are finding difficulty in accessing services, the only other comment I'd make is a significant portion of these services are delivered by private individuals, dentists, fee-for-service physicians. They're not employees of the healthcare system. They are governed by their licensing body, and the expectation is that they will make themselves available, and that if there are challenges there and people feel disadvantaged, then the first port of call should be the clinician, and failing that, maybe even the licensing body. So I would refer you to that. There's been no attempt, and indeed every accommodation to make sure the special measures orders did not disadvantage people in isolation for whatever reason. In terms of the ongoing briefings, next week on Wednesday is budget day, and so we have elected to move the afternoon briefing to Tuesday. These weekly briefings will continue with myself. Dr. Fitzgerald is taking some well-earned time off for the next couple of weeks, so it may just be me for the next couple of briefings. In terms of our daily press releases, given the nature of the epidemiology and prevalence in the province at the moment, and to allow staff to concentrate on other duties, we have decided not to issue daily releases on a go-forward basis now, unless there is something special or a new case or something like that. However, so that the media and the public will be informed on a regular basis. The hub, the website, will be updated on a daily basis at some stage between 2 and no later than 3 o'clock in the afternoon of each day to provide people with information around COVID and the testing that people want to hear about. So from my point of view, that really rather concludes my comments. Again, I would just echo congratulations. It is a marathon and not a sprint, and there are some hurdles in this marathon. We are doing well, and we should take some comfort from that. And indeed, national commentators have commented about what is it that Newfoundland and Labrador are doing right. What is it the Atlantic bubble seems to have got right? And there is no secret sauce or magic bullet. It's been diligence. It's been multiple small changes that have made the difference. And I would encourage all of us to carry on with it for as long as it's necessary. So with that, Kathy, I'll turn it back to yourself for media. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 4 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. If time permits, there will be an opportunity for further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you, Minister and Dr. Fitzgerald. The Prime Minister is addressing the nation this evening after the throne speech most likely in regards to COVID and the coming of a second wave. What in particular will you be watching for in his speech?
I'll start off there. Thanks, Kellyanne. From my point of view, I would look to him to echo some of the discussions that we've had at the health minister's table about some of the challenges with what I think have been referred to in other discussions as pandemic fatigue. I think there is a place for that, which has left some provinces exposed. I think I would look also to seeing what support the federal government will continue to provide. We have had guarantees in the past of, for example, reagents for testing, for swabs, and for PPE. And whilst we are in a much better place now than we were before on that score, I would look to further reassurance that support for those kind of issues would be ongoing. I can't speak for the rest of government, but certainly I would hope that, and be optimistic, that in actual fact he will make some reference to ongoing economic support for those businesses and individuals who've been really challenged so far and will continue to be if this is the second wave.
Thank you. Public health officials across the United States and Canada are becoming targets with personal threats leveled against them, hate mail sent to their homes and offices, and many now have police protections. Why do you think public health experts are being targeted? And Dr. Fitzgerald, have you faced any threats or harassment during this pandemic?
So I think any time that, you have a situation where we're asking people to change the way that they do things and significant restrictions, you're gonna have some pushback from that, and that's to be expected. I think it's unfortunate that people feel that public health officials who are doing their jobs, and I think here in Canada, well, and I think elsewhere in the world, are doing their jobs well. It's unfortunate that people feel that public servants deserve to be the target of such harassment, I guess, or threats. Personally, I've not received threats, but certainly we've had in the public health division, we've had our share of emails that aren't necessarily in agreement with some of the things that we have done, but we have to accept that as part of the job, I guess.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Dr. Fitzgerald, the school on the West Coast has had about 150 student absentees apparently since the beginning of the year. I'm wondering if your office is thinking of removing symptoms from its checklist as BC has done for students.
So certainly, we're always looking at symptoms, and we're looking at what we need to do to make sure that we target our testing so that we get the most effective testing possible. And so at the moment we are looking at our symptoms. How we will change those or if we change them at all is another question, but it is something that I think a lot of jurisdictions are looking at. And now as children have gone back to school and we see more of what symptoms are presenting in children with COVID, because up until this point, we haven't had a large amount of experience with children with COVID, so that may change with regard to how we look at symptoms in children versus adults. So all of that information is being evaluated, and certainly if we feel we need to change things, we will, which we've said from the beginning. If the evidence changes, we'll change to match that.
Okay, thank you. And on the topic of children as well, some rotational workers are finding daycares won't take their children after the 7-day isolation period. So they might be free, according to the new measures for them, but the daycares won't take their children under those circumstances. Do you have advice to daycare operators on that practice?
So certainly our recommendation from a public health point of view is that any child of a rotational worker is permitted to attend daycare as long as the rotational worker is not symptomatic. Then they are allowed to attend daycare and they're allowed to attend school.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
As was mentioned in the sort of preamble, it has been 2 weeks since schools opened, and we've seen no cases of COVID-19 connected with schools. What does that tell you, Dr. Fitzgerald?
I think at this moment in time, it tells us, as we know, that our prevalence is low in our community. That's not to say that that can change, and so we always have to be diligent and make sure that anyone with symptoms is getting tested, and as we've recommended, with two or more symptoms, and just to make sure that we're all staying diligent with our public health measures. Certainly, we know that in communities with lower risk of community transmission, then we see a lower risk of transmission of COVID in schools. Schools are a reflection of what's happening in the community. So, at this point, I think what it tells us, I guess, it confirms or affirms what we know, or what we believe to be true at this point, which is that the prevalence is low.
Minister Haggie, we've seen the decision that both doctors and pharmacists will be able to charge to deliver flu shots this year. Why was that decision made when considering in the past those groups haven't been able to bill government to deliver flu shots?
Well, the pharmacists, Peter, have actually been able to provide flu shots at MCP's expense to NLPDP recipients, and that's been in place for some considerable time. Our concern this year is that we are going to have, we hope, a very big demand for administration of flu shots. And as I've said on other occasions, anybody whose scope of practice allows them to give a flu shot is someone I would like to be out there in the evenings and on weekends doing just that. Pharmacists and physicians, it is well within their scope. My aim would be to have these individuals actually giving flu shots, and we have to recognize that with compensation.
Thank you.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
Thank you, Kathy. I'm just wondering, the virtual care services and coverage under MCP, is there a deadline for that? And what is the status of it now? We're hearing, I've heard October 1st, but I'm not sure about that. I'm just looking for some clarification on virtual care.
Yes, there was a rolling extension of virtual care provisions under the pandemic. We have agreed with the Medical Association that we will continue these indefinitely. That's been agreed and is now in place. At some point in the future, if either party wishes to terminate the arrangement, then they can do so with notice, obviously. They can do that. But we have no intention of removing what we believe has been a popular and valuable service.
Thank you. And off the top, there was some mention there, of, be patient with various employees that are, making sure that whether it's at the border, at the airports, and even school administrators. I'm wondering, that was mentioned off the top specifically, do you have some specific cases or examples of that? Are you getting feedback on that point and the severity of it?
I think at this point we just have received some feedback that there has been some issues from time to time in these areas, and we just think it's always a good idea to reinforce that these people are doing a job and an invaluable job, and we need to be respectful of that.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Getting a few questions regarding the saliva test that's beginning to be used in BC. Wondering if we're looking at going in that direction as well for testing.
The saliva test, the test that BC is using, it's a little bit different than a straight saliva test. So they're swishing and gargling. So it's taking a sample from a little bit further back. So BC has developed that test themselves and within their own province and are using it there. So, we're looking at the information about that test, but at the moment there are no definitive plans to use that here.
Thank you. And I'm not sure if I got a second question here, but in case I do, we know with the MCP covering flu shots, doctors now being able to do it in pharmacies as well for free. What are we expecting our influenza rates to be like? We know in other provinces they've drastically gone down considering the measures put in place. I'm wondering if it's much of the same here.
Are you asking influenza rates or influenza vaccination rates? Sorry, Kellyanne.
Influenza rates, sorry.
Well, I mean, many of the measures that we've put in place can help to reduce the spread of influenza as well. So, only time will tell, I guess, but hopefully we will see a reduction in the spread of that, here with the use of masks in public places. But we know that influenza can get in lots of ways, and sometimes, despite our best efforts, finds a way of getting in. So I expect we will continue to see cases of influenza this year.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. I'm a woman who says her father, a veteran in a wheelchair, and for various reasons was unable to wear a mask, and he was treated rather abruptly by staff at the hospital. Can you clarify again whether someone in that situation has to wear a mask, or whether they have to indicate exactly what their exemption is for?
So we have not asked. With public health here at the department and in the special measures orders, we have not asked for people to provide proof of what their exemption may be. However, if a workplace, for example, is requesting that an employee have a reason for an exemption, that's a bit of a different situation, and certainly. For people who aren't able to wear a mask, I would certainly advocate kindness and respect in that situation.
Okay, thank you. And I just wanted to talk a little bit about Halloween. You say that guidelines will be up. I just want to compare them to guidelines that have been brought in other places, and one of them would be that children are advised to only go to homes where they know the person. Was that one of the things you're considering?
So I think it depends on our epidemiology. It's difficult to make really definitive recommendations right off the top. If our epidemiology continues on as it is, I think Halloween will, there'll have to be some modifications for sure, and I don't know if I'm an advocate of saying that children should just go to any house anyway. I think small kids, obviously, most of us would agree, would have to be watched carefully. Certainly, if we were to see an increase in cases of COVID in the next 5 weeks, then the safest recommendation at that point would be to trick or treat within your your close friends, your extended bubble, that sort of thing. But I guess time will tell what'll have to happen.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Thank you. I have a question about exemptions. When someone joins the military, they give up their MCP card because they have federal coverage. I talked with one person whose son joined the military last year, lives in temporary accommodations on the base in Trenton. He applied to come home for 6 weeks, and despite having a plan to isolate, was denied. Why are military members whose only real home is Newfoundland and Labrador not being allowed back in?
So I can't speak to any individual situation in that regard, Peter, but if there is a concern about a denial, certainly an appeal can be applied for, and if there's new information during the appeal process, we have to go by the information that we have in front of us, and if there is new information that can clarify a situation, then we certainly welcome that.
This person
Peter,
did
just
appeal.
to,
Yep, go ahead.
sorry, I didn't mean to cut across you. I was just going to add to that, the issue of documentation to support ordinarily residents, I think is the term, in Newfoundland and Labrador. MCP is certainly one of the easiest because that's kind of a prerequisite to get the card. But it's not the only piece of documentation that we would accept. Again, I would echo what Dr. Fitzgerald said, that if there is a concern about a decision, that, excuse me, there is an appeal mechanism.
They indicated to me that they have appealed and were denied. I'm just wondering, for military personnel who are, I guess, in their view, they're considered more rotational workers in as much as they're being deployed elsewhere for a period and want to be able to come home. I'm just wondering why military members aren't being able to allow to do that.
So I don't know that that's, to speak to it as a group of people. I'm not sure that we've had, significant numbers that have applied in that regard. So, but certainly on any individual situation, if someone wants to provide more information, they absolutely can. And even if they have appealed, they can still provide more information if they feel they need to clarify something. Absolutely.
Thank you.
Peter, I think just as context, we have had significant discussions at my level and with Dr. Fitzgerald, for example, with senior military personnel in Atlantic Canada, because, of course, posting season is usually June and July. And we did make public health guided adaptations for people who were being posted and coming to the province and moving around. And indeed, we have regular discussions through military liaison about things like the search and rescue aircraft flight that came in last week for ferry purposes and also for supporting our military in their missions on base and that kind of thing. So, again, if there's a specific case that needs to be re-examined, that's not an issue. But in general, I would describe our level of cooperation both provincially and in my own district, for example, with Lieutenant Commander Bass Valley Hayes and 9 Wing, as extremely close and cordial.
Thank you.
Our next questions are from Brian Callahan of VOCM News. Please go ahead.
Thank you, and thank you to Mr. Jackson. I think he sort of covered off what I wanted to do there on Halloween. Other than the fact I just wondering specifically when you will issue whatever guidance there is on Halloween, just officially. And other than that, congratulations on your time off, Dr. Fitzgerald, well-deserved. I don't know, I think some people might be wondering, but if it's a personal question, I apologize, but I'm wondering if you have any plans to travel abroad, given the current situation all worldwide, and I think people might be interested in your judgment and guidance on that.
I don't have really good, I'm not really good at hiding my facial expressions on that question. No, I would, well, first of all, on the Halloween question, I hope it'll be out by the end of the week. With regard to travel, no, I certainly am not traveling outside of the province during my time off. Just looking forward to some peace and quiet and rest and relaxation. That's it.
Thank you very much.
Kellyanne Roberts, do you have any further questions?
I just have one other question regarding the 811 line. We know that there's one separate for students, especially with them having gone back to school. Hearing a lot of them that there's no waiting music, essentially, and then when it does come through, it sounds like it's being hung up on the other end. Just wondering if we've had issues with the 811 line or if we're looking to add more resources to it.
We have had issues more so with the Eastern Health public health booking line. We have metrics, very detailed metrics from PhoneMed and 811 specifically, which are consistent with adequate resources at the moment. They certainly do get surges, and Monday particularly was a day of surge. There were some technical issues with the phone provider in Eastern Health yesterday, which caused some grief, for want of a better word. We are working through that, and I know Eastern Health is continuing to add resources where needed to match the demand.
Thank you.
Peter Jackson, did you have any further questions?
No, other than to wish the doctor happy holidays as well. Thank you.
Peter Cowan.
A question about by-election that's underway right now. Should candidates be going door to door, and how safe do you feel in-person voting is, Dr. Fitzgerald?
So I think, given our prevalence at the moment, there are measures that can be put in place to make this safe. It's certainly, as a lot of the same precautions that many of the retail stores have put in place can be put in place with regard to physical distancing and waiting in line and that sort of thing. So, and mail-in ballots certainly are helpful in that regard as well. So there are ways that things can be done safely. And I expect, we've certainly been in contact with the provincial elections group to discuss some of those measures. So, I feel that measures have been put in place.
And what about for the candidates and their staff when they're campaigning?
Well, certainly, we would recommend that you maintain physical distancing at all times, that if you are not going to be able to do that, or if you're in public places, in public buildings, that you wear masks, that sorts of things, all the same advice that we've been giving all along, and just, have precautions about handing out information and things like that.
Okay, thank you very much.
And Brian Callahan, did you have any final questions?
Just one final issue I just wanted to broach. I just want to know if you're concerned with any issues of complacency setting in smaller schools. We're hearing more and more anecdotal evidence, or calls, and some of them don't seem unfounded. It's just the issue of the younger kids, just more and more as days go by, and no cases and all of that sort of thing. That seems to be a complacency where kids are a lot closer. Some masks are not as enforced in some cases. I mean, I know this is going to happen, but are you concerned about this complacency factor?
So we always worry about these sorts of things, but people have been quite good up to this point, and I think will continue to be so. I think the fact that we see the cases that we've had, that have come in over the past couple of months, reminds us that COVID is still out there, and certainly what we're seeing elsewhere in the country right now should be a reminder that things can change very quickly. So we do have to be cautious, and we still have to be careful. And even though we have a low prevalence at the moment, that can change. So we do need to make sure that we adhere to those personal measures. And the public has been very good at stepping up to this point, and I think they will continue to do the same going forward.
Thank you again.
Thank you, Dr. Fitzgerald. Minister Haggie, did you have any final comments?
No, just to thank everyone for their interest and attention, and to wish Dr. Fitzgerald a pleasant break too, and if need be, I will separate her surgically from her cell phone.
Thank you, Minister.
Thank you very much for tuning in. Please join us again on September 29th at 2 p.m., 1:30 in most of Labrador. Have a great evening, everyone.